Hi, I'm Adrienne Hudson, and I'm here at Legacy MD Internal Medicine and Med Spa. And I'm really excited because I'm doing my countdown to 4 months till 40. And Dr. Momar is going to be doing my Botox and helping to beautify me. And I hope that you follow me on this journey. Dr. Momar has great plans, monthly plans, for both his internal medicine practice and for the med spa. Today I am going to be getting Botox, and I'm really nervous because I don't like pain, but I have this little 24 karat beauty bar that numbs your veins, so when they're doing the injection it doesn't hurt. So hi.
Hi.
How are you?
It's good to have you here.
Yes.
What we're gonna do today is we're gonna try to do Botox for the forehead and for the cross feet around the eyes.
Mhm.
Of course, the forehead would help with both, would help for aesthetic purposes and also would help for the migraine as well. What we try to do here at Legacy MD is to prevent two things. One is to prevent pain, and two is to prevent bruising, actually. So the machine that I haven't showed you yet, which is our magic wand, and actually we use it's called the AccuVein, and it shows all the veins in the forehead. And after we actually get the veins, here I will demonstrate for you. So if you look, you can see that all the veins, right?
Oh, wow.
So what we do is actually we use it on the forehead and we draw. The other thing that we do is, as you said, we use the 24 karat beauty bar, which actually by vibration it decreases the pain, right? Because the same nerves that transmit pain, they transmit vibration. So by introducing vibration, they are less likely to be able to introduce the pain, right? So that helps with pain quite a bit.
Oh, good.
Okay.
That I'm in the right place.
You are. I promise. And that, of course, decreases the infection possibility, because every injection can introduce infection into the skin. And I do recommend that if anybody is having Botox, that day before they come to the clinic, they don't wear any makeup.
Okay, so I
Yeah.
failed on that one big
Yeah.
time.
It's okay. It happens all the time. It's no big deal. It just makes it a little easier. To cleanse the area.
What are the benefits of Botox? I understand, I know what it is for migraines, but why does that help now? Why should somebody get Botox?
So with aging, we will have lines, forehead lines, and we will have lines around the eyes, and we will have lines in the glabella area. Now, these lines with time, they change from dynamic lines, what we call them dynamic lines, which means that they are only visible when you are expressing an emotion, to static lines, which means that they are there all the time, even though you're not expressing any emotion. And the longer you wait to take care of those, the harder it becomes to actually treat them. Because at one point, like here, if we look at your forehead, you really don't have much of static lines. Most of your lines are dynamics, and I guess you had Botox before.
Yes.
So that's exactly what I'm trying to say, that when you treat them early, then you don't have those deep crisps, because these deep crisps, they are not treated by Botox only, then you have to use fillers as well. So more products and more cost is just because you haven't started early enough, right? So it's the better, the earlier you start, the better it is.
Perfect.
Right? Yeah.
Okay.
Close your eyes, please. Okay, so now we're trying to draw some of the major possible bleeding veins.
I really like how thorough you are and how you take your time, because most times when I've gotten Botox for reasons, it's, oh, hi, and then doing the
Yeah,
injection,
there's-
and I really love that you take your time.
No, I mean you have to, yes, because you don't want any. It's not so. Unfortunately, in many cases, they take the injections into the forehead as an easy thing to do, but in reality, no, it can have some complications. Especially like apoptosis, or what we call it apoptosis, which is a drop of the upper eyebrow lift. So it's not. Technically, it's not as simple as it seems to be, right? So open your eyes. Just look at me straight. Look at me right there. So. Okay.
So I love it that you are an internist as well, and that you spent time as an ICU doctor.
Mm-hmm.
So you take every precaution for your patients.
So it's very important before doing any of those injections to know the anatomy and to know the layers of the skin. It's not as simple as it looks. It looks simple, but in reality, it's not really that simple. Yeah, because you can do some. The good thing about Botox is none of the complications with Botox is permanent. That's one thing. It's whatever the side effect or the adverse reaction is, it's temporary usually, right? Yeah. So a smile for me. You want to do the beauty bar? So you gotta be from the other side.
Yeah, I have to come around this way.
Mm-hmm.
Okay. This is actually relaxing.
The beauty bar?
Yeah, because you don't feel it that much.
Yeah, you don't feel much.
And we also have the ice. Maybe you want the ice.
Yeah.
You good?
Ooh.
Oh, I'm good with that.
Okay.
Turn your head towards me. Okay. Of course, the injection in the glabella area, it's a little bit deeper injection in the belly of the muscle.
How many did you do?
3?
3.
Oh, I didn't even feel it.
Oh, there you go.
Okay. I have to close my eyes though, but
Okay.
so I can do.
Okay, that's good. Raise up your arms.
Like that?
Mm-hmm. Okay. Are you interested in an eyebrow lift or not?
Do you think I should get one? I'm
Well,
gonna let you.
So the eyebrow, what it does when it lifts it up, it opens up a little the left side. So with aging, what happens is the lateral side of your eyebrow starts to drift down.
Okay.
So the older we get, the heavier is the side of the brow. So if we want to do, then we avoid to put some Botox here, and the fibers of the muscles here stay
Yes.
active and they pull it up a little bit. So if you want, we can try and see how it's going to look.
Okay,
And then
yes,
upon the touch up, if you don't like it, we can put some, and then yeah.
You're the expert. I'm
But-
letting you.
Yeah, it's a matter of
I want to look great
preference.
for my 40th.
Okay, you
Yes.
will.
Okay.
I promise you will. We usually recommend for our patients that they stop taking any over-the-counter medications like ibuprofen or Aleve or aspirin
Okay.
for 2 to 3 days before coming to do the procedure, because that
Okay.
decreases the possibility of bleeding as well.
Okay, so that was my fault.
Yeah, I mean you can. It's just if you can avoid the,
Mm-hmm.
taking the. Good, you're doing great.
Thank you. So when you come in, don't wear makeup and don't take any over-the-counter medication, just so you know. But it doesn't hurt. I actually really like that beauty bar. Does that work for all the fillers and stuff too, or just Botox?
For the Botox, yes, main part. For the fillers, most of the fillers are mixed with lidocaine.
Okay.
Most of them, and the ones that are not mixed, we can actually manually mix them with lidocaine. And sometimes, we use the ice bar on the area that we're gonna treat, and that decreases again the pain and the bleeding. With the fillers, we don't use the beauty bar that often because it doesn't help much, because after the first poke, you don't feel much. One thing about our practice is that we try to use the safest methods out there.
Okay.
And regarding the fillers, is that we use cannula in general. We don't use needles. So that even for the lips and the nasolabial folds, that will decrease the amount of pain associated with the procedure.
Okay.
Yeah, and that we will,
Just
we will perform the procedure on you at one point, right?
That's it. I'm good. I'm done.
Yes, you're good.
Wow. Okay.
1 second. Yep. So, and to decrease the possibility of bleeding, again, we can use over-the-counter cream. It's called Arnicare.
Okay.
Right? So Arnicare is something you can buy over the counter. It's a vitamin K derivative, and it helps with bleeding.
Okay. Took pictures before, so you can see my before and after. And I have to say, this really didn't hurt that bad, but
That's good.
So before it was more painful, and this time it was not.
it was not as painful now.
That's the touch of Courtney.
My beauty,
This
the
is-
beauty went on you.
This is amazing. I love it. And so this is gonna. So did we do the lift for the eyebrow? Is that what? Okay.
Yes, we tried to leave this areas untouched,
Okay.
which means we didn't put much of the Botox there,
Okay.
which means that the fibers are going to be active,
Okay.
and they will, and this area is going to be modified. So the muscle here is not going to move. So these muscle fibers goes in effect, and they will pull it up a little bit. We have to understand that we need to keep things natural. So, naturally everybody has a little bit of movement.
Mhm.
So we like to keep that as well. We don't want anybody when they come to have Botox to go out and then suddenly everybody knows that they
Yeah, that they
have
have
done
Botox.
and they look unnatural.
No, I'm just kidding. Just
Yeah, so
Stone face.
so stone
About
face. So it's very important to us that we keep a little bit of motion, so it
That's
doesn't look. You just look like your skin has been rejuvenated, and you look younger and prettier.
That's what I need.
Without anybody telling what did you really do.
did I really do? It's a secret.
What I found was that-
So of course, for 3-4 hours, you can't really scratch the area. You can't rub it. Don't do any physical activity, and don't lay down for the next few hours. Those little small redness on the forehead, it will go away. within a few hours, and after that you can wear makeup no problem.
So just so I know to tell my husband, no vacuuming,
No,
no doing the dishes, no laundry, no carpool today. Just need to sit down, elevated, and read a magazine today.
Yes,
Got
yes,
it.
and a glass of wine.
Exactly, my kind of doctor. Okay. Well, I appreciate it. Thank you so much for
Absolutely.
everything. Thank you.
Absolutely. Yes, thank you.
Okay. Thank you.
All right.